Hi, I'm Allie Cook for the Dental News Network. Today is September 12th, 2012, and this is your Wednesday Watch. Here are today's top stories, brought to you by Johnson & Johnson Listerine. Scientists have identified a strong oral carcinogen in smokeless tobacco, according to a release from the ADA. While there is evidence suggesting an increased risk of cancer of the mouth, esophagus, and pancreas for users of chewing tobacco, snuff, and similar products, until now, no substance in these products was clearly implicated as a cause of oral cancer. The doctor who led the study would like to see this information spread among younger users who may mistakenly believe that smokeless products are safer than cigarettes. Smokeless tobacco can also lead to receding gums, worn teeth, and loss of teeth, in addition to bad breath and nicotine addiction. 1 out of every 2 American adults aged 30 and over has periodontal disease, according to recent findings from the CDC. Pulling from data collected in 2009 and 2010, it is estimated that 47.2%, or nearly 65 million American adults, have mild, moderate, or severe periodontitis. In adults aged 65 and older, prevalence rates increased to just above 70%. Also of note, periodontal disease is higher in men than women and is highest in Mexican Americans compared to other races. Also having high prevalence rates are current smokers, those living below the federal poverty level, and those with less than a high school education. Coming up, products and procedures, but first, here is a brief message from our sponsor.
Yep, that's your mouth, and it's surprising what it goes through in the course of a day. But what's even more surprising is that brushing alone isn't enough to keep it clean. Fortunately, you've got Listerine. Unlike brushing, which misses 75% of your mouth, Listerine cleans virtually your entire mouth. So what are you waiting for? It's time to take your mouth to a whole new level of health. Listerine, power to your mouth.
And now, products and procedures. If the eyes are the window to the soul, it could be said that the mouth is the window to a person's oral health. So what does that make the dentist? As we know, gums that are swollen and bleeding and teeth that are covered in plaque can be indicators of chronic health conditions such as diabetes, hypertension, heart disease, and more. Some newly released research linking oral health to overall health has prompted some questions about the role of dentists with regards to their patients' overall health. Dr. Brian McAllister is legislative chairman for the Delaware State Dental Society, and he addressed this issue recently in the News Journal. Now we're tying in more serious issues with our profession, he said. Where does that leave the profession of dentistry? Does it give me more clout to talk about health care? I'd like to ask our Wednesday Watch viewers what their thoughts are on this. What do you think about the blurred lines between dental health and overall health? What do you see the dentist's role as in the future? Please write to us and let us know. Thanks for checking out the Wednesday Watch. We'll see you next week with more from Dentistry Today and DNN.